Hello friends, today we will learn about this bone. This bone is clavicle. So we will see the anatomical features of the clavicle and what are the attachment on this bone. So first of all, you must know that this is clavicle and this is an example of long bone. So when we classify the bone like long bone, short bone, so clavicle comes under the example of the long bone. So you must remember that though it appears to be small in size, but it is an example of long bone. So there are certain peculiar feature about this clavicle because this is the only long bone in the body that lies horizontally in the body. Otherwise you will find the other bones, other long bones in the body, they lie longitudinally in the body, such as humerus, you know about the radius ulna, they all lie in a longitudinal position, but this is the only long bone that lies horizontally in the body. Next, this is the first bone to ossify, and the ossification is membranous, and it is only long bone that is having two primary ossification center. Otherwise you will find the long bones are usually have one primary ossification center, but this is clavicle, and this clavicle is having two primary ossification center. It has no medullary cavity inside, and it is throughout it is subcutaneous. You can feel in your clavicle, you can feel from the surface. So this bone is subcutaneous, you can feel from the surface, and there is no medullary cavity, and this is often pierced by the supraclavicular nerve. So these are certain peculiar feature about the clavicle which often the examiner may ask you in your professional viva. So you must remember these 7 points about the peculiar feature of this clavicle. Now coming on to the parts, then we will discuss about the side determination, because clavicle is 2 in number in our body. One is on the right side and one is on the left side. So the first question in the exam, in the viva, you will be asked about the side determination of the bone. So whenever the bone is 2, that is one on the right side and one on the bilateral in position, that one on the right side and another on the left side. So the examiner, the first question of the examiner is what is the side of this particular bone. So first of all, you know that there are 2 ends in this bone. This is clavicle. It is having 2 ends. One is your medial end and one is your lateral end. Then you have the shaft. This part, the cylindrical part in between the 2 ends, is known as shaft. So coming on to the side determination, first of all, you can see this medial end is quadrangular in shape. You can see this medial end is quadrangular in shape, while the lateral end, you can see it is flattened. It is flattened from the superior to the inferior side. It is flattened from the superior to inferior side, and this medial end is quadrangular in shape. You can see the difference on both the side. Now coming on to the shaft is divided into the medial 2/3 and the lateral 1/3. The medial 2/3 is convex anteriorly. So from this point you can determine the anterior and the posterior of the clavicle. In the anterior side, the shaft, the middle 2/3 of the shaft is convex, while the posteriorly it is concave. So the medial 2/3 of the shaft is concave posteriorly and convex anteriorly. So by this we can determine the anterior and the posterior of this clavicle. Now for superior and inferior, you will find a groove that is known as subclavian groove on the inferior side in the middle third of the bone. If we divide this whole clavicle into medial 1/3, middle 1/3 and the lateral 1/3, so in the middle 1/3 on the inferior surface, you will find a groove. So this groove should face inferiorly. So by this you can determine the superior and the inferior of the clavicle. So by these 3 points you can determine the side of the clavicle. So this clavicle which I am holding, this is of the right side, because the medial end which articulate with the sternum. It is quadrangular. The lateral end which articulate with the acromion of the scapula. It is flattened, and the shaft in the medial 2/3 convex anteriorly, and you will find subclavian groove on the inferior side. So by this you can determine the side of this clavicle, and this clavicle is of the right side. Now coming on to the surfaces and the borders and the details about the parts of the clavicle. So in this you can see the lateral part, which I have told you that this is flattened from the superior to inferior side. So superior inferior it is flattened, and it is having two border. One is anterior border and the one is your posterior border. So the lateral end is having a posterior border and the anterior border. On the anterior border you will find there is a tubercle that is known as deltoid tubercle, and this deltoid tubercle gives origin to a muscle that is known as deltoid. So this red color is marked on the lateral side on the anterior border of the lateral end. This gives origin to the deltoid muscle. Now on the posterior side of this lateral end you will find the attachment. This is the posterior border, and on this there is insertion of a muscle that is known as trapezius. So this blue color area is showing the marking of the trapezius muscle, which is basically the insertion point of the trapezius muscle. The superior surface of this lateral end is quite smooth, while you can find there is some elevation and the ridges on the inferior surface of the lateral end. You will find a tubercle that is known as conoid tubercle, and from this conoid tubercle you will find ridge extending on the lateral end, and this is known as trapezoid ridge. On this conoid tubercle and trapezoid ridge you will find the attachment of the Coraco clavicular ligament, and that Coraco clavicular ligament is having two parts. One is the conoid part, which is attached on this conoid tubercle, and the one is the trapezoid part, which attaches on this trapezoid ridge. And this lateral end is basically this articulate with the acromion. That is why it is known as acromial end. So here you can see an articulating surface, a facet, and which articulate with the acromion process of the scapula. And at the margin of this articular facet you will find there is attachment of a capsule that forms the the acromioclavicular joint. So around the acromioclavicular joint, around this facet you will find the attachment of the fibrous capsule. Now coming on to the lateral end, you can see the lateral end is quadrangular in shape, and you will find the attachment of the ligament that is known as sternoclavicular ligament, and then you have on the whole of this margin you will find the attachment of the fibrous capsule. So on this margin of the lateral end you will find the attachment. This green color area is basically the marking of the fibrous capsule around this joint, sternoclavicular joint. And then coming on to the lateral end of this shaft, on the lateral end of this shaft you will see there are certain surfaces. One is your superior surface. You will find the superior surface, you will find the anterior surface, you will find the inferior surface, and then you will find the posterior surface. So this lateral end of the shaft is the medial end of the shaft is having four surfaces. One is superior surface, then you have the anterior surface, then you have the inferior surface, and posteriorly you will have the posterior surface. On these four surfaces you will find the attachment of the four muscle. First of all, the superior surface. This is the superior surface, and this superior surface gives origin to a muscle that is known as sternocleidomastoid. So this red color area which is marked over here, this is basically the clavicular head of the sternocleidomastoid. Then on the anterior surface you will find the origin of another muscle, and this muscle is basically the clavicular head of pectoralis major. Pectoralis major is a very large muscle on the pectoral region. So one part of this pectoralis major muscle is arising from this medial end on the anterior surface of this clavicle, and this is basically the clavicular head of the pectoralis major. Now coming on to the posterior surface, you will find there is origin of a muscle that is known as sternohyoid. Sternohyoid basically arises from the posterior surface of the manubrium, but when it approaches to the hyoid, it gives some fibers. Some fibers of that sternohyoid muscle originate from the posterior surface of this clavicle on the medial side. If we see on the inferior surface, on this subclavian groove, you will find there is insertion of a muscle. This blue color area is showing the insertion of a muscle that is known as subclavius. Subclavius arising from the first rib, and that get inserted on this groove that is known as subclavian groove. And around this groove, on the margin of this groove, there is attachment of a fascia that is known as clavipectoral fascia. So this green color area is showing the marking of the clavipectoral fascia. So this is all the attachment of and site determination and the parts of this clavicle, which you must know for your viva exams. And the clinical importance of this clavicle is like other bone, it also gets fractured. So the weakest part of this clavicle is basically at the junction. At the junction of the medial 2/3 and the lateral 1/3, this is the weakest part of this clavicle. Whenever there is a bend or there is junction of two parts, one is your convex part and the one is your concave part. So at the junction of this two, the medial 2/3 and the lateral 1/3, this part is basically the weakest part of the clavicle, and it often gets fractured during the road traffic accident or any violence. So this bone gets fractured most commonly from this side. So you must remember the site of this, most common site of the fracture in the clavicle, that is this point at the bend of the curvature of this clavicle. Sometimes this clavicle may also be absent. You will find in some patient the clavicle on both sides, this bone is absent. So you must know about all these features of this clavicle, the attachment of the clavicle, and some clinical importance of this clavicle. Thank you so much.